society, we have to figure out how to live with this virus for a while. Are we going about it? Are our recommendations as good as they can be on how to live with this virus and have whatever this economy looks like for the next 12 to 18 to 24 months, however long it takes us to either vaccinate or herd immunity?
We're not. And let me just give you a case in point. The segment you had on before I was on, where you were touting the mask. Let me tell you, there's a lot of data that do not support that masks work. Okay? So we all want a happy message. We want to be able to say they work. But let me just give you two cases in point, besides the data on what you just shared with the hamsters. In 1918, extensive studies looked at masks and how well they worked in reducing the cases there. They found no evidence in any of the studies they did. Think about this. The mask wearing of all the places in the world was the highest in Hubei province in China in November and December. It's just a matter of cultural use. Did that stop that pandemic from firing up and spreading the way it did? And so we can go into the data on, well, how well does a mask take out big particles or aerosols or things like that? But we've got to stop having happy talk. We want that. I understand that. I want that. I'd throw the kitchen sink at this virus if I thought it would work. But we've got to start having legitimate points. We have a report out today on testing. We have grossly overstated the testing capacity of this country and what impact it has. Testing is important, but we've been going at it the wrong way. Contact tracing. We have made elaborate claims about contact tracing can do, and yet the data are very sparse. We've got to have these honest discussions because we're going to be with this virus till we get to that 60, 70, or 80% protection level. This could be months and months and months. And it's not me. I'm the messenger. The virus is going to do what it's going to do. It's biology, chemistry, and physics. It's not politics. And we've got to understand that. And we're not understanding that right now at all. We're just not.
Doctor, there are a lot of people, myself included, that have put a lot of stock in masks, given what I've seen from the research that I've read, at least, and what I've heard from politicians, certainly here in New York City, where mask wearing is a mandatory thing if you're leaving and you can't socially distance. Coupled with the socially distance, coupled with the washing the hands, is that a good measure, or are you saying that? What exactly are you saying? Is it better for us to stay inside and not leave the house?
No, I'm not. I'm not saying that, but I'm also saying I don't want to give people who may be at increased risk of having a serious illness or dying feeling protected by having a mask on. Again, Katie, come back to the very physics of what masks do. If you're wearing an N95 respirator, the tight face-fitting mask that we recommend healthcare workers wear, then that is highly protective. But if you wear a surgical mask or a cloth mask, you're not breathing very much through the filtering. You're breathing through the loose sides that are open. This is where the aerosols, these tiny particles float. 2 more papers just published in the last 2 days showing how important aerosols are. Katie, if I put a cloth mask on right now and just talk to you, the aerosols pour out of the side of that mask. So if I'm infected, clearly I'm going to potentially infect others, but more importantly, I'm breathing in. So if you're standing next to me and I think now because I have a mask on, I'm protected, therefore I don't have to worry, that air is going to come right in the side of that mask. We're not having those kinds of discussions. We need to. Why? Because it matters. Because if people who need to really protect themselves are counting on us, giving them information that is not correct. This is not religion. This is science. And we have got to understand it's not what we believe, it's what do the data tell us. And the media has contributed a lot to this. And we gotta end that. We gotta have honest discussions.
Well, let me ask you this, Dr. Osterholm. Would you open a restaurant now at 25 or 50% capacity? And if you would, how would you recommend somebody do it?
Again, another critical question. Why did we get into this to begin with? We got into all these closures to shave the peak, to basically flatten the curve. And I think we've accomplished that in most locations. At this point, I think we're going to start to see potentially cases dropping regardless of what we do. Now, do I want people to go out and be in crowded locations? No. Do I think this disease is horrible? Yes. But at the same time, when do we make that decision that it's okay to be in public spaces? We're not having that discussion. Find me one state that actually adhered to the criteria that had been established earlier about reopening, and I can't find one. So at the same time, if cases should go back up, what's the criteria for that? So part of it, again, we're not having these honest discussions about what is our long-term goal here? Is it to stay locked up for 18 months? Should we do that until we get a vaccine? I don't think so. Society as we know it would die. But we can't let these cases go. So I would say to people at high risk of having a serious outcome, Right now, I'd avoid public spaces. Whether the government protects me or not, I got to protect myself. I would also say to anyone who is listening to this right now that you have to understand the vast majority of what's going to happen is yet to come. And we're not planning for that. We're all dealing with happy talk of just getting over the curve and then we're going to be okay. So we have got to develop plans to say we can't lock down. We can't just let it go willy-nilly. What are we going to do? And I keep talking about threading the rope to the needle. People say, what do you mean? I'm saying society has to come together. Let's have straight talk about masks. Let's have straight talk about testing. Let's have straight talk about contact tracing. Let's have straight talk about how we're protecting our healthcare workers or not. We're not protecting our healthcare workers. Then we can make a decision and say the world is not going to be safe. But what level of safety are we willing to accept for the price that we're willing to pay? And again, we need that discussion so badly, so badly.
Yeah. Well, Dr. Osterholm, the answer to that question changes depending on who you ask that question to. Because I do think that is ultimately, we're trying to figure that out as a society. What cost are we willing to have to open up the economy? And it's a conversation nobody wants to have bluntly because it involves life and death. Dr. Osterholm, it's straight talk. That's what we say.